Now we'd like to bring in our next guest in the program, and actually who will be with us at the Forum in Atlanta, Jeff Polter, Senior Vice President of Magellan Rx Management. Jeff, good morning.
Good morning. How are you?
I'm doing great. Nice to have you here. You coming to us from Michigan today?
I'm coming to you from Michigan. It's beautiful weather here today, about 65 degrees. No complaints.
Hey, no sports talk, but are you a Michigan or a Michigan State person? Because your host is a Buckeye.
Yeah, we know that.
Well, Jeff, nice to have you here. Yeah, there you go. Nice to have you here with us, and you're going to talk about a really important piece. And as I did allude to in the audience, you and your team will be present with us at Forum coming up in Atlanta soon. We look forward to seeing you there. But pharmacy benefits is now really kind of explodes probably more to employers than it's ever been, and transparent pricing is so important. But give us a little background on Magellan Rx, and then we'll kind of dive into some of these key talking points, if you would, please.
Sure, absolutely. First of all, thank you so much for having me. And we do look forward to being at the event as well. So Magellan Rx is a full-service pharmacy benefit management firm, similar to any of the other PBMs out there, but they have a very different focus in the sense that Magellan Rx started as a different company. They started as a behavioral health company. Magellan Health, everyone knows them, been around for 45 years, and they are very heavily into the behavioral health side. So they'll go into states, take on the sickest populations, actually take risk on that population and manage them throughout their whole process. And so as a result of starting sort of on the flip side, if you look at PBMs, all they did was they started as claims processors. And as a result of that, they got pushed into what else can we do around healthcare. With us, it's exactly the opposite. We started really managing the health of patients and then figured if we build a great PBM on this model, we will be able to manage members, not just process claims. And so that's kind of the model of Magellan Rx.
Yeah, and I think it's real important today when it comes to pharmacy benefit management that there needs to be that understanding of the consumer. There needs to be that understanding of employers' needs. I mean, PBMs used to be buried inside a health plan, right? I mean,
Correct.
No one really paid much attention to it. And now, there's, you talk about transparency, and I'd like you to talk more about that. Talk more about the importance of transparency. Talk more about, the reception for directly connecting members with pricing tools for pharmacy benefits.
Right. So if you look at the world of healthcare, just as you indicated, there's only one piece of healthcare that is point of sale today, surprisingly enough, in 2016, and that is pharmacy. Right, your medical is not billed when you go to the doctor. Your durable medical equipment's not billed when you go to the doctor. All that stuff is post. The only one that when you get to to pick up something, you're being told you're rejected is pharmacy. And so pharmacy over the years, as you indicated earlier, 5-10 years ago, pharmacy was like dental on a balance sheet. Nobody cared about it much. It was 10% of the healthcare spend, 5%, 11%. Over the years, past 5, 6, 7 years, it has really increased, and now in some organizations it's 25, 30%. Now that's not necessarily a bad thing, because as we know, people are living longer, they're living better lives, there's more cures that you could do outside of the hospital. That's great. But if we only depend on that, we're going to end up spending a lot of money for stuff that has no ROI to it. And so what's happened over these years is the member has been brought in as a much stronger partner with the employer on the spend. So the traditional, as you see in your world, we're seeing a lot more of it by us. The days of sort of that flat $10, $15, $20 copay difference between brand and generic is $20 is really moving quickly away. And that's being driven by the market. It's being driven by Obamacare. It's being driven by Medicare, where it's pay for value. There's a lot of components that bring that into the mix. And so what's happening is the member is becoming much smarter early on to understand that they're going to be paying a lot more, and therefore they want to understand the spend a lot better. Pharmacy has always been a black box. Our industry has made sure to keep it a black box because you can do a lot of things when it's a black box and no one can see it. And so what we've done is we've gone out and said, hey, at the end of the day, we have to remember there is a person on the other end of this transaction, a human being, that needs their medication. And they deserve and earn the right by utilizing our services to be able to get the best information as easily as possible. And so what we did was we went down the path to say, what is it out there technology-wise that we can utilize or partner with that can provide members a different experience that adds the tremendous value? And so if you look today in any of the insurance business, right, whether it be your medical or your pharmacy or your dental, how many times would you ever log on to your information? The statistics out there for PBMs is 3 to 5% of people ever even log into their profiles online, and if they do, it's one time. What we did was, and it was funny because our partner was looking for the same solution at the same time. There's a company out of Los Angeles called GoodRx, and GoodRx started in the discount drug card business. They basically went out there and said, we're seeing all these different discount drug cards. We're seeing a bunch of them. Some are good, some are not good. We want to take all these together, aggregate them, and provide the member that if you're filling this script and this zip code, we're going to give you the best possible deal. And so what happened as a result of that was that they started becoming very successful in that, but they started getting calls from human resource departments, from employers saying, I got a member that's on a high deductible health plan, they pay the first $1,000, and they're complaining terribly that they're going out to pick up their prescriptions, they're paying for them through our plan, and then they find out from a friend that Walmart's got it for $4, or this one's giving it away for free, and it's even less than their plan. And so they began to realize that there's a real opportunity here to somehow take the same concept of aggregating data in a very easily usable solution technology and provide it out to the membership. And so we partnered. We started this about close to 2 years ago. It has been enormously successful. Just to give you an idea from utilization standpoint, I indicated earlier it's about 3 to 5% utilization. With us, it's 86% is our average utilization for the clients that we have integrated in GoodRx. And the reason is because it's not a technology. In the healthcare world is a lot like the banking world, right? Our technologies, even if they look slick and they're older, that's not our strength. Our strength is processing claims very efficiently. And so with GoodRx is made up of a couple of ex-Facebook guys. I think number 2 and number 3 employee, Yahoo guy. These guys come in and they're technologists. They're not healthcare people. They're technologists. Right. And so what they've done is the whole model of the GoodRx product, just to give you kind of the 30,000-foot level, is that you don't even have to do anything and we will generate your interest. So what we would like you to do is when you go to the doctor, we'd like you to log into the app and see what the cheapest place is for your prescription. But let's say you didn't do that. Let's say you went to the pharmacy just like you do. Within 24 hours, you're going to automatically get an EOB that's going to tell you, explanation of benefits. It's going to say, hey, Jeff, you filled your claim at XYZ store and you paid. By the way, are you aware that less than a half a mile away, there is another store that has that prescription for $18 less? Times 12, you would save. Times the number of drugs you're on, you would save. By the way, you have 2 refills left. Would you like us to transfer those to the other place? You didn't do anything yet. You just got an email. And now all of a sudden, as opposed to sort of looking at data that I don't know, I'm not going to worry about it until I need it, I now have something that tells me that I bought something yesterday that I could have gotten a lot cheaper, and you're going to make it really easy for me not to have to go back and pick up my prescription and find another pharmacy. And so the whole model is that it communicates with you as opposed to you having to communicate with it. And the beauty is it goes on forever. So if you're on a maintenance medication and you're filling it at the big box store and it's the cheapest one, and now a store across the street starts competing for it and it's cheaper, the process automatically begins again, and you don't have to do anything other than accept and say, yes, I want to transfer. And to be very clear, what we don't want is we don't want people on 5 prescriptions to go to 5 stores. So we bulk everything together, and we call it My Shopping, and you could put all your drugs in there, and it'll tell you for these 5, this store is the cheapest, even though for maybe 2 of them they're more expensive, but in aggregate they're not. And so what we have found is the feedback we get from members are just unbelievable, where they're saying every single time they fill a script, they have always gotten the cheapest possible price. And so in this whole world of consumerism, HR departments are in love with this because now they don't have that struggle that they had, which is members are finding out they can get it cheaper even on a discount card.
Well, that's very interesting. Ron?
Yeah, this is very exciting technology and ways to engage the consumer with information at the time that they really need it so that that learning point that you can get their attention because they're actually using the system.
Correct.
The other uniqueness, it seems to me, that Magellan has, for those of us who've been around for a while, is the history related back to Magellan Health as a mental health company. And on the prescription side, it seems to me today I'm hearing more about people who need medications for stress and depression in their lives, for sleep difficulties. Can you talk a little bit about maybe the mental health history and how that might feed into the kinds of services and recommendations for medications so that people can get the right kind of care they need for stress and depression needs, as opposed to going into a primary care physician that doesn't know what they're doing and they wind up getting stress tests and all sorts of care that they really don't need, when underlying maybe some medication might be the real issue, or seeing a psychologist.
Sure. So going back to what we said originally, right? So Magellan Rx, as you said, Magellan Rx started as Magellan Health, and we still have Magellan Health, which is a very large part of our organization. What we've done is, in Magellan Rx, we talk a lot about this, is if you look at our world, the PBM world, it's really a volume world, right? How big is your network? How many claims do you process? Because if you process 10 billion claims, you're going to get it a penny cheaper. Everything is volume. Magellan Rx has a very different view. Yes, you need to compete in the volume side. You need to compete in pricing. But we believe in value. And the value is exactly what you're talking about here. So when we look at a case, and again, we provide as much or as little. It's very a la carte to the client. You have clients that want all your clinical services wrapped in, and then we bring in a full slew of clinical services to the client, or we have clients that want more processing and a few clinical services. But the whole concept is exactly what you just said. When we look at a client's data, we don't even just look at their pharmacy data. We look at their medical data. We marry that data together. We identify opportunities. So if we have a prospect that comes to us and says, hey, price this file and tell me how much it would have cost if I used you, we'll do that, and we obviously do that. But then we come back and we say, hey, within your data we found 5 things that we recommend you change. We don't think that you should have X number of these prescriptions, for that amount of quantity on a monthly basis. We come back to them with sort of those clinical things, or when we see something in the medical side that doesn't have prescriptions associated with it, like what you just said, we immediately alert the client to that as well, saying, hey, are you aware that there is this situation? And so in those, we allow clients to enroll, so members can enroll in a program. So, for example, when a member fills a specialty prescription through Magellan Rx, what happens is we don't just fill the prescription. The first thing we do is reach out to the member. Make sure the member knows, and the member gets their own concierge nurse line where they can speak to the same person all the time. And we want to make sure, do you understand the disease state? We provide technology. Every time we send out a specialty medication, you can scan the bag that it comes in. It gives you a movie about what your prescription is, how to use it, an 800 number to contact 24 hours a day for any needs. And then what we do is we want to make sure that we're getting the return on investment. So, for example, and I'm not a pharmacist, so please don't quote me, but if you take Sovaldi, right, Hep C Sovaldi, there's a lot of situations where members will take that Sovaldi. It's a $90,000 drug, 85, whatever it is. Take it for their 90 days or 60 days, whatever it turns out to be, and it did not fix the problem. They still have Hep C. And so the doctor will prescribe something else. And nobody is going the step further to say, first of all, I want to monitor the patient, right? So we know that if a member is an alcoholic, or if they're drug use, the Sovaldi will probably not work. And so you've got two issues, where one is you're going out and you're having them fill a prescription that you're not going to get a return on investment in, and two is that you're shipping out 90 days worth of a drug that maybe after 2 weeks we're going to find out probably shouldn't be used. And then we take it one step further, and we do what's called, which Magellan has about 20 or 30 nurses that are actually trained in what we call motivational interviewing, which came again from the Magellan Health side. And that drives a lot around adherence or other issues that can affect adherence. So we know there are a lot of organizations out there that will, it comes to your 85th day, will ship out your medication. What Magellan does is they work out a timeline with the patient, and they'll contact the patient, and they'll get to know the patient and all of their surroundings. So they will identify through motivational interviewing that maybe the spouse is really pissed that this member's sick. They'll get involved with the spouse, And they'll say, just basically flip it and say, hey, here's the great news. If he or she takes the medication, they're going to have a perfectly normal life. And so things, or they'll say, did you take your medication? The patient will be like, yes. And they'll be like, when's the last time you took it? Yesterday. How many pills do you have left? Oh, about 20. Well, you should only have about 6. So you're having a problem. And really just staying engaged with the patient to make sure that not only are you taking the medication, but you're taking the medication the way you should, 1, and 2, that it is having the effect it should have. And so a lot of that stuff is coming from the Magellan Health side to teach us more on how when they go into the state of Florida and they take the sickest population and they get paid, I don't know, I'm just throwing out a number, $1,000 a month for the patient, they're stuck with that. That patient can cost them $1 million a month if they're not careful. And so they really know how to break down sort of that health component to drive that the pharmacy piece is not only the patient is getting what they need when they need for the right person, but that the results we're getting are the correct results as well.
Jeff, this is really good stuff, and we've got about a minute to go. So, again, I want to remind our audience they can come and learn more from Magellan, at IHC Forum in Atlanta. I want to give you a chance to kind of close it and leave our audience with some good takeaways, and would love to have a pickup conversation sometime in the future about this as well.
Absolutely, that would be great. I would just say that this whole concept around consumerism, for years we've been talking about it. HSA accounts, and it's real now. It's very real, and the member and the patient who is now paying into, as employees, we all pay into a healthcare system, whether we pay a lot or a little, we're paying into it, and we are now expecting a lot in return. And I would just encourage all employers that when it comes to implementing these programs, that you give the tools that members need to be able to make the best decisions. And this is not something, like I said, that's going away. I think this is going to increase. We're seeing at least a 30% increase year over year in our high deductible health plan business and things like that. So I would just say that we would love, and any assistance we can provide, certainly, but the concept of what we're talking about is something that applies to all pieces of health.
Yeah, it makes a ton of sense. And tell our audience, if they're listening to either now live or in a future podcast, how they can get in touch with you to learn more.
Sure. So I can be reached at my personal contact information is Jeff Polter is my name. My email address is japolter, Polter, @MagellanHealth.com. And I would be glad if it's not something that I personally provide assistance with. I can certainly put them in touch with the correct people.
Yeah, Jeff, thank you so much for joining us. Enjoy your weekend up there, and we will see you in about 2 weeks here in Atlanta.
Wonderful. Thanks so much.